With summer now in full swing, you may already be enjoying the wonders of the great outdoors. But there's one pesky bug you should keep in mind before you pack up your gear and take that next camping trip: ticks. These tiny bugs are important to watch out for as they carry a number of infectious diseases. According to the CDC, tick-borne diseases have been on the rise in the United States for the past several years. Luckily, Dr. Bobby Pritt says there are several steps you can take to reduce your risk of getting a tick bite this summer.
Part of the first step of knowing how to prevent tick bites is to know where you'd be at risk. So ticks cannot fly or jump, but they can climb up on tall bushes. And so tall grasses, leaf litter, low-lying shrubs, those are all areas where ticks may be found. And so if you are going into those areas, you need to take precautions against tick bites.
Pritt is a professor of laboratory medicine and pathology and the director of clinical parasitology at Mayo Clinic. She's an expert on parasitic infections and vector-borne diseases, which result from infections transmitted by blood-feeding animals such as ticks.
Ticks can spread a number of harmful bacteria, viruses, and even parasites, none of which you want to get. So the most common tick-borne infection in the United States is Lyme disease, and that can be quite serious if not treated right away. You certainly don't want to get that. But then there are also viral infections, other bacterial infections, and even a parasite called Babesia microti that can cause a potentially fatal infection that can be difficult to treat.
Pritt says a key step to preventing these diseases is wearing bug spray. However, she mentions that not all repellents are created equal.
Bug spray would work, but there are certain types that are better than others. And you can go to the EPA, the Environmental Protection Agency, and they have a list of the different types of bug spray to protect you against ticks and mosquitoes. I stick with the ones that have at least 30% DEET. There's another chemical called picaridin. And then if you don't like those, there's also oil of lemon eucalyptus, and they all three are rated quite well. They'll protect against tick bites and mosquito bites.
DEET is a chemical found in many bug sprays. It works by hiding our scent from unwanted pests like ticks and mosquitoes. Another commonly used compound is picaridin. It's similar to DEET, but odorless and non-greasy.
There is another agent that you can apply directly to clothing and gear, and that's called permethrin. And in fact, you could even apply it the day before, let it thoroughly dry, and then you can wear that garment, even wash it a few times, and it will still have a protective effect.
Once you've returned home from time outside, Pritt says it's important to make sure you haven't picked up any sneaky bloodsuckers. Ticks aren't picky. They'll latch onto any part of the body, so you'll want to check everywhere. And I mean everywhere.
Well, you could find the ticks anywhere, but there are some places that you may be less likely to notice. So you really want to do a thorough head-to-toe tick check, and you're going to want to do it on yourself as well as your children, your significant other, and then also your pets. And pets, you can also take an additional preventative step by seeing your vet, and there's certain agents you can apply to your pet to prevent and help repel ticks.
No one ever wants to find a not-so-friendly guest on their skin, but it's important to know how to remove a tick safely and effectively. Pritt says it's best to remove the pest right away.
The longer a tick is attached, the higher the risk of getting a tick-borne infection is. Some bacteria and viruses can be transmitted within minutes to hours. Viruses in particular can be transmitted within 15 minutes. Lyme disease, though, takes at least 36 hours for the tick to be attached and feeding to allow transmission.
Lyme disease is the most common vector-borne disease in the U.S. About 30,000 cases are reported to the CDC every year, but the actual number is likely much higher. And though most cases can be treated with antibiotics, removing the tick quickly will help protect you from the disease altogether. For the most effective removal, Pritt recommends using a pair of fine-tipped tweezers.
So the best way to remove the tick would be to pinch it with those fine-tipped tweezers really close to the skin and then pull out in a very firm, continuous motion without twisting so that you don't accidentally twist off the mouth parts and leave them in your skin. And you also want to avoid damaging the tick itself. You don't want to squeeze it, crush it, damage it in any way. That may increase the risk of it transmitting some type of pathogen to you.
You may have heard of some other methods for removing ticks. Maybe your grandmother swears by smothering the bug with Vaseline or even burning it with a match. But Pritz says these are old wives' tales and are not a good idea.
All of those things could also just damage the tick and increase the risk of transmission. And of course, if you're trying to smother it with petroleum jelly, that means you're going to keep it on your skin longer. Best to just take it off.
Once you've successfully removed the tick, Pritz says it's important to keep an eye out for symptoms of tick-borne diseases.
Any type of symptoms during the spring or summer months, or even early fall, that would potentially include a fever, headache, body aches, joint pains, and often a rash, should make you consider that you may have a tick-borne disease. And at that point, it would be important to go to your physician, tell them you've potentially been exposed to ticks, and explain the symptoms you've had. That way, the physician or healthcare provider can perform the necessary testing and sometimes even give antibiotics to prevent disease.
So if you plan on being outside this summer, keeping these tips in mind can help you stay healthy and active. Pritz says the best way to implement these protective measures is to simply make them a part of your everyday routine.
In the morning, if you're going to go out into the woods, you're going to go hiking in tall grasses, you're going to go mow the lawn or go gardening, and you're worried that there might be ticks available, just like you should be putting on that sunscreen, you should put on some tick repellent, and you're protected, and then you don't have to worry about it. And of course, if you're outdoors for a period of time and there's a lot of ticks, you're going to want to also check yourself well when you come in. Just make it part of your routine, and then you can enjoy the great outdoors and not really worry about it.
You can find more information about Dr. Bobby Pritt and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Tabor Brewster. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
Some of these eponyms are associated with true criminals, with Nazi perpetrators, and those certainly should not be quote-unquote honored.
Breaking down the controversy around honorific names in medicine.
Then a controversial intervention for high-risk pregnancies.
Bed rest is the most prescribed intervention in pregnancy, but there's no data. That doesn't mean that's the right thing to do.
All that and more on Radio Health Journal. I'm Elizabeth Westfield, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Many people just sort of shrugged and said, well, it's God's will. If I live, I live. If I die, I die.
Looking back to when cancer research was considered a losing battle. Then,
you could buy bottles of tincture of cannabis from the big drug companies like Eli Lilly.
A brief history of cannabis and its entry into the U.S. market. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes, and Stitcher.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
It's time to get your checking account to zero with free checking from PenFed. That's zero ATM fees, zero balance requirements, and zero time spent waiting for your paycheck to direct deposit because you can receive it up to 2 days early. Open your account with just $25 and see how big zero can be. Apply online today at penfed.org/free checking. Early direct deposit eligibility may vary between pay periods and timing of payers' funding. To receive any advertised product, you must become a member of PenFed, insured by NCUA.
PenFed's got great rates for everyone.